Magnesium sulfate. It is an electrolyte. Mechanism of action: it corrects torsades de points by increasing blood serum magnesium levels. It also reduces striated muscle contractions and peripheral neuromuscular transmissions by reducing the release of acetylcholine. It causes some bronchial smooth muscle and relaxes the bronchial smooth muscles, and it can also relax the uterus. It is pregnancy class D technically. Some things we're going to use it for: eclamptic seizures, torsades de points or hypomagnesemia, life-threatening dysrhythmias due to digitalis toxicity, and then status asthmaticus and bronchoconstrictions that aren't responding well to typical albuterol and atrovent treatments. Some contraindications going to be heart blocks and then myocardial damage as well. We don't want to antagonize that at all. Some adverse reactions to keep in mind could be central nervous system depression, hyporeflexia, so we might lose some of our reflexes, respiratory paralysis, vasodilation, abnormal ECG changes, and then heart blocks. And it can potentiate other central nervous system depressants, so we want to watch out for that. Typical adult dosing is going to be 1 to 4 grams, either IV or IO, and for the kiddos, 25 to 50 milligrams per kilogram, IV or IO, and then based on your local protocols, that'll either be as a push or a slow infusion or maybe over 10 minutes, something like that. Just depends on what you're giving it for and your local protocols. It does start working pretty much immediately. Peak effects kind of varies, and it only lasts about 30 minutes or so. So one thing we want to keep in mind is we're not going to give it if we expect the pregnant female to deliver within the next couple hours. We want to try to avoid that. If we've given it or given too much of it, IV calcium can antagonize the effects and kind of counteract that if necessary. And anytime we're giving this, especially on transfers or where it's been given in high dosages, we want to monitor reflexes, monitor the respiratory drive, make sure they don't have any muscle weakness, anything like that. And then if any of those are present, we would want to make sure that we stop the magnesium infusion.